Dementia doesn't start at 80. It starts at 40, quietly, without a single symptom you'd notice. And the things you're doing right now, today, things you call normal, might be the earliest signals your brain has been sending you for years. But here's what most people never hear. There is a window. Neurologists know about it. Researchers have studied it for decades. And inside that window, the process can be slowed. In some cases, stopped. The problem? Most people never see the window because they don't know what to look for. By the end of this video, you will. And no, it's not about vitamins. Let's start with what dementia actually is, because most people have it completely wrong. They think of it as a switch. One day, your mind is fine. Then something flips, and it's not. That's not how it works. Dementia is a process. It unfolds over 15, 20, sometimes 25 years before anyone around you would even notice. Think of it like rust on a pipe. The pipe doesn't fail the day you see the hole. The rust started years ago, invisible, inside the wall. The hole is just when it broke through. By the time someone gets a diagnosis, by the time a doctor sits across from them and says, "You have Alzheimer's," the disease has typically been progressing for 15 to 20 years. Let that land. Now, here's your first fast takeaway, and it matters. Forgetting where you put your keys is not a symptom of dementia. Not on its own. Not occasionally. Normal forgetting is this. You forget something, then you remember it later. Your brain just filed it somewhere inconvenient. Pathological forgetting is different. It's when you can't retrieve it at all. When the event, the name, the word just doesn't come back, like it was never stored. That distinction is real, and neurologists use it diagnostically. So when does normal forgetting become a signal? There are 4 types of signals, 4 categories your brain uses to tell you something is changing. Most people know about memory. That's signal 3. But signal 1, almost nobody talks about it, and it shows up years before memory does. We're getting there. But first, let me show you what's actually happening inside your brain right now, because once you understand the mechanism, everything else clicks into place. There are 55 million people in the world living with dementia right now, and roughly 1 in 3 of them didn't know they had it until it was advanced. Not because the signs weren't there, because no one knew how to read them. Here's what's happening inside the brain. Your neurons, the cells that store and transmit everything you think, feel, remember, they communicate across tiny gaps called synapses. It's like millions of tiny conversations happening in parallel every second. Now, your brain produces a protein called amyloid. Normal. Necessary. It's part of how neurons communicate. But in some people, and we don't fully know why yet, amyloid doesn't clear properly. It starts to clump, to stick together between neurons, like plaque building up. And here's where it gets important. Those clumps, called amyloid plaques, don't cause noticeable symptoms right away. Your brain compensates. It reroutes. It works around the damage for years, burning through what neurologists call cognitive reserve before you'd ever notice anything was off. That's why the rust metaphor works. You don't feel the corrosion. You feel the result when the system finally can't compensate anymore. Now, let me tell you about a man we'll call David. David was 47, sharp, successful, the kind of person who never forgot a name, never lost track of a conversation. Around 48, his colleagues started noticing something small. He'd pause mid-sentence, searching for a word that should have been instant. He'd repeat a question he'd asked 5 minutes before. Not often, just occasionally. David laughed it off. "I've just been working too hard." His wife noticed something else. He'd get mildly lost driving routes he'd taken 100 times. He'd miss a turn, recover, say nothing. He attributed it to distraction. At 52, David was diagnosed with early onset Alzheimer's. When his doctors looked back at the progression, at brain scans from a research study he'd enrolled in at 46, the amyloid accumulation was already visible, 5 years before his first complaint. David's story isn't rare. It's the standard trajectory. And the reason I'm telling you this isn't to scare you. It's because David's story also has a second chapter, and that chapter is about what happened when he did start intervening. We'll get to that. But first, the 4 signals. Because if David had known what to look for, the timeline changes. Signal 1, language and word retrieval. Your brain processes language in the temporal lobe. Forget the anatomy. Here's what matters. Language processing is expensive for the brain. It requires fast, precise connections between multiple regions simultaneously: memory, semantics, motor control for speech, all firing together in under a second. When those connections start to degrade, language is often the first thing that shows it. The signal isn't dramatic. It doesn't sound like confusion. It sounds like this: pass me the thing, the you know what I mean, the remote. You know the word. You can almost feel it, but it won't come. Neurologists call it anomia, word finding difficulty. Occasional, normal. Everyone does it. Increasing frequency, that's the signal. Specifically, if it's happening more than it used to, if words that were automatic are now a search, that's your brain telling you the retrieval network is under stress. Here's a quick self test you can do right now. Name as many animals as you can in 60 seconds. Out loud. Go. Most adults under 60 with healthy cognition can name 18 to 22 animals. Under 14 is a clinical flag, not a diagnosis, but a flag that neurologists follow up on. Language fluency isn't just a communication skill, it's a window into your neural network. When the words slow down, something downstream is changing. Signal 2, spatial navigation. Here's a strange fact. London taxi drivers, the ones who have to memorize every street in the city before they can get their license, have measurably larger hippocampi than the average person. The hippocampus. That's your brain's GPS, your spatial memory center, and one of the first regions where Alzheimer's pathology appears. Here's what that means for you. When your hippocampus is healthy, navigating familiar spaces is effortless, automatic. You don't think about the route to the grocery store, you just go. When it starts to struggle, you notice hesitation in spaces you shouldn't hesitate. You miss a turn you've taken 100 times. You park your car and can't immediately picture where. Now, here's the unexpected part. GPS dependency may actually be accelerating hippocampal decline in the general population. When we stop navigating and when we outsource spatial memory to our phones, we stop exercising that region. The taxi drivers grow their hippocampus because they use it constantly for years. We're doing the opposite. I'm not saying throw away your phone. I'm saying the brain regions most vulnerable to early Alzheimer's pathology are the same regions we've quietly stopped training. That's not a coincidence. Getting mildly lost in familiar places isn't aging. It's a specific signal from a specific brain region, and that region is trainable. Signal 3, personality and decision making. This is the signal that almost nobody recognizes in themselves because it doesn't feel like memory loss. It doesn't feel like confusion. It feels like other people are being unreasonable. Here's what happens. The prefrontal cortex, the region behind your forehead, governs judgment, impulse control, emotional regulation, and decision making. It's also one of the earlier regions to show neurodegeneration. When the prefrontal cortex starts to lose function, the changes are subtle. You become slightly more irritable than usual, slightly less patient. You make decisions that feel normal to you, but seem impulsive or out of character to the people who know you best. You might start dropping old commitments, losing interest in things you used to care about. The insidious part, you don't notice it in yourself. You have no external reference point for your own personality shift. Your spouse notices. Your best friend notices. Your colleagues notice. If someone close to you has said something like, "You've seemed different lately," or "You're not as patient as you used to be," and your reaction was to dismiss them, that reaction might itself be worth examining. I'm not saying it's pathological, but it's worth examining. Personality changes are a neurological signal, not a moral one, and the people closest to you are sometimes the first diagnostic tool. Signal 4, sleep architecture and chronobiology. In 2019, a study published in Science changed how researchers think about the relationship between sleep and Alzheimer's. Here's what they found. During deep sleep, specifically slow wave sleep, your brain activates a system called the glymphatic system. Think of it as your brain's overnight cleaning crew. It flushes out metabolic waste, including amyloid. Let me say that again, because it's important. Your brain clears amyloid while you sleep, specifically during the deep sleep stages that most people, especially as they age, progressively lose. The relationship is bidirectional. This is the brutal part. Poor sleep accelerates amyloid accumulation, and amyloid accumulation disrupts sleep architecture, making deep sleep harder to reach. It's a loop. And once it's running, it runs in both directions. Here's what this means practically. Chronically poor sleep, Not one bad night, not occasional insomnia, but years of fragmented, shallow sleep is not just leaving you tired. It's leaving your brain less clean than it should be every morning. The signal to watch for isn't just I sleep badly. It's this. Do you wake up feeling restored, or do you wake up feeling like you never fully got there? That distinction between sleep that cleans and sleep that doesn't is measurable, and it matters. Sleep is not downtime, it's maintenance. And the specific maintenance it performs, clearing the proteins that drive Alzheimer's, makes it one of the most powerful levers you have. Now, you know the four signals. But here's what most videos stop at. They give you the symptoms and leave. I want to go one level deeper. What accelerates the process, and why most of what people do about it doesn't actually work. There are 6 factors that neurologists consistently identify as accelerants, not causes, accelerants, things that push the timeline forward. 1. Chronic vascular stress. What's bad for your heart is bad for your brain. Hypertension, arterial inflammation, poor circulation, these reduce the brain's ability to clear waste and sustain neural networks. Vascular dementia is the second most common type, and it often develops alongside Alzheimer's pathology. 2. Chronic psychological stress. Cortisol, your stress hormone, is neurotoxic at sustained high levels. Long-term stress literally shrinks the hippocampus, the same region that's first hit by Alzheimer's pathology. Stress isn't just uncomfortable, it's corrosive. 3. Social isolation. This one surprises people. Sustained social isolation is one of the strongest independent risk factors for dementia, not a contributor, an independent risk factor, roughly equivalent in impact to physical inactivity. The brain is a social organ. It was built to process other people, their faces, their voices, their intentions. When it stops doing that, it atrophies in measurable ways. 4. Sedentary lifestyle. Physical movement increases BDNF, brain-derived neurotrophic factor. Think of it as fertilizer for neurons. It promotes new connections, supports hippocampal volume, and has the most robust evidence base of any single intervention in cognitive health. More on this in a moment. 5. Metabolic dysfunction. Insulin resistance in the brain is now sometimes called type 3 diabetes in the research literature. The link between metabolic health and Alzheimer's risk is so strong that some researchers argue metabolic dysfunction is a prerequisite, not just a risk factor, for a subset of Alzheimer's cases. 6. Untreated hearing loss. This one is underappreciated. The cognitive load of compensating for hearing loss, of straining to process every conversation, diverts resources that your brain would otherwise use for memory and executive function. Studies show correcting hearing loss in midlife measurably reduces dementia risk. Now, here's the mistake. Most people hear a list like this and think, I'll deal with that when it becomes a problem. That's exactly how the window closes. Here's a better way to think about it. Your brain has a cognitive reserve, a kind of buffer, built over years of education, stimulation, complexity, social engagement. When the disease process starts consuming neural resources, the reserve buys you time. People with high cognitive reserve show symptoms later, even when the underlying pathology is equally advanced. It's like 2 people with the same amount of rust in the pipe. One pipe is thicker. It holds longer. The reserve isn't fixed. You're building it or depleting it right now, every day. One more thing before we get to what actually works. Let's clear the floor. Fish oil supplements? The clinical evidence is weak, not harmful, just not the intervention the headlines promised. Crossword puzzles? They make you better at crossword puzzles. Cognitive improvement doesn't transfer robustly to other domains unless the activity is novel and complex. Most brain training apps? Same story. The interventions with real evidence behind them look less like products and more like behaviors. That's either the most frustrating thing I'll say or the most liberating, depending on how you look at it. Remember David? I told you his story had a second chapter. Here's what happened. After his early onset diagnosis at 52, David enrolled in an intensive lifestyle intervention program at a research center, not a drug trial, a behavioral intervention. 5 years later, his rate of cognitive decline had slowed significantly, not reversed, but slowed, measurably on imaging. His neurologist told him something that David later said changed how he thought about everything. We didn't stop the disease. We gave your brain more time to be you. More time to be you. That's what the window is, not a cure, not immortality. More time inside the window where you are still fully yourself, making decisions, recognizing faces, having the conversation you want to have. So, what actually works? 4 interventions with the strongest evidence base, not theories, clinical evidence. Intervention 1, aerobic exercise. This is not a lifestyle suggestion. It's the single most evidence-supported intervention for brain health. 150 minutes of moderate aerobic activity per week. That's a brisk 22-minute walk every day, measurably increases hippocampal volume, elevates BDNF, improves sleep architecture, reduces vascular risk, and slows cognitive decline. In a landmark study at the University of British Columbia, older adults who did aerobic exercise for 6 months showed a 2% increase in hippocampal volume. The control group, doing stretching only, showed decline. 2% doesn't sound like much until you know that typical age-related hippocampal shrinkage is about 1 to 2% per year. They didn't just slow the loss, they went positive. The mechanism matters. Exercise releases BDNF, which literally promotes the growth of new neural connections. It also improves cerebrovascular health, the blood flow your brain needs to clear waste. You can't replicate this in a pill. Not yet. Intervention 2, sleep optimization. You already know the mechanism, the glymphatic system, but knowing it and using it are different. The practical lever here isn't just sleep duration. It's sleep architecture, specifically getting enough slow wave and REM sleep, which is where the clearing actually happens. What disrupts architecture? Alcohol within 4 hours of sleep, irregular sleep timing, blue light suppressing melatonin, chronic stress keeping your nervous system activated. What supports it? Consistent sleep and wake times, even on weekends. A cool room, no screens for 30 to 60 minutes before bed. And, interestingly, morning light exposure, which anchors your circadian rhythm and improves nighttime sleep quality hours later. These aren't hacks. They're how your cleaning system runs properly. Intervention 3, social complexity, not just having people around. Cognitively demanding social engagement, deep conversation, disagreement, navigating other people's emotions and intentions, learning something with someone. The brain research on social engagement is clear. Socially complex environments, not passive togetherness, but active social processing, build cognitive reserve and reduce dementia risk independently of other factors. The loneliness epidemic isn't just a mental health crisis. It's a brain health crisis. Intervention 4, novelty and cognitive complexity. Remember, crosswords don't transfer, but learning a new skill does. A new language, a musical instrument, a complex craft, a sport with strategy. What these have in common, they require your brain to build new pathways, not just use existing ones. And that process, called neuroplasticity, is protective. The brain you want at 80 is built by the challenges you take on at 45, 50, 55. And now, the thing I promised you. The thing almost nobody talks about. It's this. The window isn't open for a moment. It's open for years. Most people assume, because the disease process starts in your 40s, that the intervention window is narrow, that you have to catch it early or it's over. That's not what the research shows. Even in people with early stage Alzheimer's, even with visible pathology on imaging, behavioral interventions change the rate of progression. Not for everyone, not dramatically in every case, but measurably, consistently, in study after study. The window isn't a door that snaps shut, it's a gradient. And you are always somewhere on that gradient, which means the most dangerous thing you can do isn't having bad habits. It's deciding it's too late to matter. Let me bring this all together. There's a version of getting older that most people are terrified of. Not death, something worse. Being alive, but not present. Not recognizing the people you love, not finding the words, not being yourself. That fear is legitimate. But here's what I want you to take from this video. That outcome, the one you're afraid of, is not a fixed destination. It's a probability. And probabilities respond to what you do. Dementia is not a light switch. It's a dimmer, being slowly turned by biology, genetics, and behavior over decades. And of those 3 inputs, biology you can't change, genetics you can't change, but behavior is yours. The 4 signals: language, navigation, personality, sleep. They're not diagnoses, they're data. Your brain communicating something you can act on. The 6 accelerants: vascular stress, chronic stress, isolation, sedentary life, metabolic dysfunction, hearing loss. These aren't abstract risks, they're levers. Levers you can move. The interventions: aerobic exercise, sleep architecture, social complexity, novel learning, not complex, not expensive, but specific. There's a concept in neurology called compression of morbidity. It means the goal isn't just to live longer, it's to compress the period of decline into the shortest window possible at the end of a long, healthy life. Live fully for as long as possible. Decline briefly, leave. That's not naive, that's measurable. And it's what the research points toward when people take their brain health seriously, early, consistently, without waiting for symptoms. Here's the image I want to leave you with. Think of your brain as a city built over decades: roads, bridges, communication networks, power lines. In dementia, the infrastructure starts degrading. Roads crack, bridges weaken, some routes get cut off, but cities can be maintained. New roads can be built, detours can be created when old routes fail. The city doesn't have to fall, it has to be tended. That's what you are doing when you exercise, when you sleep well, when you have a real conversation, when you learn something hard. You are tending the city. And the best time to start was 20 years ago. The second best time is right now. If this video gave you something, one thing you'll actually do differently, I'd ask you to do this. Don't let it sit in a tab. Pick one thing from this video, one thing that's realistic for your life right now, not a full protocol, one thing. Maybe it's a 20-minute walk tomorrow morning. Maybe it's texting someone you haven't spoken to in 6 months. Maybe it's deciding tonight that your sleep schedule is actually a health decision, not a preference. One thing, do it tomorrow. If you want to go deeper, there's a lot more we didn't cover today. We didn't talk about the specific genetic variants like APOE4 that affect individual risk and what they mean practically. We didn't talk about the emerging research on metabolic interventions. We didn't talk about what the early diagnostic landscape looks like now, what tests are available, what they can and can't tell you. Those conversations are worth having, but they start here, with understanding that this is a process, not an event, that there are signals, not just symptoms, and that between where you are now and where you don't want to be, there is a window. You're standing in it.